Urinary tract infection is an infection affecting any part of the urinary tract. So the infection can extend from the kidney, the ureter, the bladder and the urethra. So urinary tract infection is basically an inflammatory response of the urothelium to bacterial invasion. Now, how common are the UTIs? UTIs are common more in women than in men. Why these UTIs are common in women? Because women have a short urethra which is around 4 centimeters in length, and it is in close proximity to the anal canal, which is the source of these organisms. These organisms gain access to the urethra, they enter the bladder and cause the infection. And in postmenopausal women, there is an alteration in the tissue composition, thereby increasing the chance of getting urinary tract infection. Men also have UTIs, but these men frequently suffer from the sexually transmitted infections. Now, what are the common symptoms of UTI? So usually women present with a persistent urge to pass urine, burning sensation in the urine, pain in the lower abdomen, and some women also present with hematuria, that is passing blood in the urine, and a turbid urine, and also foul smelling urine. Usually men present with a discharge from the urethra. Now, how these UTIs are diagnosed? So whenever a woman comes with a UTI, the urologist takes a proper history, examines the woman and prescribes a routine urine analysis, which gives an idea regarding the presence of pus cells in the urine or RBCs or any organism in the urine. And a sample is also sent for urine culture and sensitivity. And empirically, the urologist will prescribe a course of antibiotics and also suggests a bladder relaxant which reduces the symptoms of bladder irritability. And the women are also advised to take plenty of oral fluids, that is at least 2.5 to 3 liters a day, so that these bacteria can be flushed out of the system. Now, what are the common precautions to be taken when a woman experiences a UTI? So we prescribe some common precautions like increase the quantity of fluid intake to at least 2.5 to 3 liters per day, which causes the mechanical flushing out of the bacteria from the system. And we also advise women to wipe the genital region from front to back rather than from back to front. And we also advise women not to hold urine for longer periods of time, which gives a chance for the bacteria to grow in the bladder and cause a urinary tract infection. We also advise women not to use spermicides or other diaphragms, which might increase the chance of getting a UTI. And also we ask the women to complete the entire course of antibiotics and not to stop in between, which might result in the development of a recurrent or a refractory urinary tract infection.